The name of the game at medical centers like this one around the country and around the Show Me State is stemming the tide of COVID-19 infections. And that puts a spotlight on the infectious disease experts who are on the front lines of battling this pandemic. So to get more insight on what these infectious disease experts do and their advice for all of us, we're joined tonight by Dr. Helen Boucher, who is from Tufts Medical Center in Massachusetts, and she's also on the board of the Infectious Disease Society of America. Dr. Boucher, thank you for your time tonight. Let's get right into it. What can you and really all of us do working together to help stop COVID-19?
Well, we in infectious diseases have been engaged in preparing for this and other pandemics for many decades, and we're now across the country in every town, city, and state working hard to prevent, diagnose, and treat the COVID virus.
Doctor, we know Springfield and Greene County are under a stay-at-home order. What needs to happen now?
I think we need to really focus on where we are now, and the epidemic is here. So we need to focus on all of the social distancing measures that have been asked of us. So washing our hands, not touching our face, wiping down surfaces in our house, staying home as much as possible, especially when we're sick, and really listening to our local leaders when they tell us about the plan for things like school closing, avoiding large crowds, and really putting up with all of these disruptive measures that have been put into place. Every one of us has a role to play.
Now, some states and jurisdictions, as you know, do not have a blanket stay-at-home order, but it's still important for residents in those jurisdictions to practice social distancing, correct?
Absolutely. We know that the virus is in every one of the 50 states, and nobody is immune. This is a virus that none of us have ever seen. So we're all at risk, and we all have a role to play, and especially young people. It's very important for everybody, but especially young people, to participate in these social distancing measures to protect themselves and to protect vulnerable older people and those with impaired immune systems.
Now let's talk a little bit about this virus, Doctor. It can live on surfaces, which makes transmission fairly easy.
We have some evidence that the virus lives on surfaces. The most common way it's transmitted is by what we call droplets. So it's when someone coughs or sneezes and when you're within 6 feet of them. So it's really important to keep that distance. That's the most important thing we can do.
Dr. Boucher, what is the training you and your colleagues have to be able to deal with a crisis like this one?
Well, we infectious diseases physicians go through 2 to 3 years of extra training, and other scientists in our field go through extra training to learn about preventing, diagnosing, and treating infections. So we are trained in the business of preparing for and dealing with epidemics like this. It's really important for us to focus on where we are now and doing what we can now to work with our local authorities to help what we call flatten the curve and to follow these measures. I think if we can do that and we can hang in there, we're going to get through this better, and it's going to allow us in the healthcare system to take care of the patients that we need to take care of the best as we can. We're already learning what great teamwork we're capable of, and I think we are engaged in teamwork like I've never seen before. That's great. The other thing that we're learning is that we need to constantly prepare for the next epidemic or pandemic that's going to come our way, and we in infectious diseases do this for a living, but we need everybody to be more engaged in this going forward.
Dr. Helen Boucher from Tufts Medical Center and the Infectious Disease Society of America. Doctor, thank you for all of your efforts that you and your colleagues are putting forth to keep us safe.
Thank you.
And we'll be back after this.